Darah's coworker found her at the office unresponsive on the floor and did the appropriate thing. She called immediately 911. When Darah got to the hospital, the ED physician assessed her and found that she did have a stroke-positive screen and therefore activated our Star 45, our internal stroke response, immediately.
Star 45 means 45 minutes from the patient entering the emergency room door to getting or obtaining final imaging diagnosis of a stroke.
So when I immediately saw Darah down in the ED, I thought, how can this be happening? She's 26 years old and just thought there's no way that she could be having a stroke.
We located a clot within the left and middle cerebral artery, which corresponded to the patient's symptoms.
The decision was made to ultimately go for intervention, and therefore our IR-GO process was initiated at that time so the patient could efficiently be moved up to the interventional radiology suite.
Here at Memorial Medical Center and with the collaboration of clinical radiologists, we are the only dedicated neurointerventional suite in the Springfield area. Once the patient is in the neurointerventional table, I access the groin or the common femoral artery and utilize the arterial system of the body like a highway in order to take my devices into the problem area intracranially. Once I reach the area of problem or disease, then I use a device called a stent retriever where I deploy this device inside the clot, let the clot integrate, and then I retrieve the stent with the clot integrated and allow for blood flow to irrigate into the tissue that was affected.
When Dr. Elias went in and removed that clot from her brain, the results were just overwhelming. Everybody in the room, there was not a dry eye. She could, when she wasn't able to talk, she can now respond. When she wasn't able to move her right arm, she could now lift it. She was following commands appropriately. The feeling that knowing that we just gave her a chance, that a 26-year-old is now going to be able to talk, she's now going to be able to walk because of what we did, that's awesome. From neurology to the ED to the imaging staff to the neurointerventionalist with Dr. Elias as the addition to the team to our rehab, it's all about the continuum of care and working the patient through the system. That's why she did well, because we have an excellent team at Memorial.
Looking at me or talking to me would have never imagined that I had a stroke. So I get to carry on with my daily activities of working and spending time with my fiance and planning a wedding. I do feel really lucky to be here today and explain my story to everyone, and I am very happy that Memorial was there to save my life.